What is rosacea?
Rosacea is a medical condition that afflicts a number of patients. What it does, it causes problems with the blood vessels in the skin. It primarily occurs in the cheeks, the nose, and the central chin area. So you will get redness in that area. You will get blood vessel formation, spider veins in the nose are very common as well. And then you also get unevenness in the skin, where the skin gets quite lumpy and bumpy. And sometimes you'll see the patients who have the big, large, red, bulbous nose. Those are all endpoints of rosacea. So in order to try to prevent them, because we can't treat them, we would want to institute treatments at an early stage, which would include lifestyle modifications, different cosmeceuticals that we would use in the office, and then the IPL treatment, which is a laser-based treatment. So again, the goal of treatment here is management and control, because these are chronic conditions that we cannot cure.
What skin types are affected with rosacea?
The skin types that are affected with rosacea primarily are the lighter skin types, so skin types 1 to 3, although we do see it in all races across the board. Obviously redness in someone who's more dark skinned is not going to show up as easily as someone who is, let's say, Scottish or Irish, for example. However, they still do get it, and you'll see the telltale unevenness in those areas, and you'll see it just occurring in those areas we talked about. So really any race can get it, although we tend to see it more in patients who are lighter skinned.
How are the products or the cosmeceuticals that you carry in your office differ than others that are on the market?
Well, I think the first thing is that because this is a doctor's office, it's a medical clinic, the grade of the skincare products that we use are obviously at a higher grade than would be available commercially over the counter. So what you're looking at is strength and potency, and that obviously then gives you effectiveness. That's the first part. The second part is just we're also able to effectively access unique products that will not only just treat the skin, but will get down to the skin on a cellular level, affect the DNA in a positive way, and so you have a cellular health where the skin cells underneath the skin are healthy. If the skin cells are healthy and they're treated properly, then the whole skin in overall way is in a better shape overall, and that's what then gives you that fresh and more youthful look.
Why should you use Sunlux, and why is it important?
Well, that's an excellent question. The most important thing is that you have to remember the sun damage that occurs on the skin is based on radiation and not the sunlight that we see, which is visible light. So UVA and UVB rays, which are invisible, are constantly bombarding our skin from the day we're born. The worst case scenario, of course, we see the early damage with the premature aging and premature wrinkling. Then more advanced damage when people get these brown spots that they call liver spots or age spots, but really they're all sun damage spots. There's no such thing as people inherit freckles. Freckles are actually sun damage spots. No one's born with freckles. They develop freckles based on their exposure as they go along through life. And of course the worst thing that can happen is skin cancer directly as a result of sun damage. And we know in North America, for example, the rates of skin cancer are just going right up through the roof, where every other cancer is leveling off or going down. So sun exposure is critical. It's also an accumulative damage that occurs from the time we're born and builds up in our system. So it may not manifest until we're 40 or 50, but we have patients who we have in our practice who are 23 and have skin cancer. The most effective method to handle sun damage is getting a proper sunblock. In the industry we call them physical blocks. So that's different than what you will very often be able to buy commercially. So we break down to two things. There's SPF scales. SPF refers to sun protective factor, which refers to the UVB rays. UVB rays burn the skin, and that's where you get a sunburn. So on that scale you need to have a 30 or more. Anything less than 30 is not very effective. What's also important is that at 100, SPF 100 and SPF 30, there's probably only a 1% difference. So patients should not get too caught up in that part of it. What's actually more important is the UVA rays. So UVA rays are the ones that do all the damage. So premature aging, premature wrinkling, brown spots, red spots, acne, rosacea, skin cancer, all of that's coming from UVA. So if we just look at this for a bit, this is a scale that shows you the UVA scale. So what we use is sunblock that covers the full spectrum of the UVA and the full spectrum of the UVB. whereas the commercially available ones will either just cover the full spectrum of B, but have really no UVA coverage. So these are the kinds of things that are critical, that make a difference for people from a health point of view. The other part of it, of course, is beauty and aesthetics. There's nothing that ages things more than the sun damage. So in our industry, we talk about the single best cosmeceutical we can possibly use is a proper physical block from the time you're a child. The sunblocks that we use and we carry in the office are, by the way, safe, not just for our clients, but for children as well. So very safe, very effective, not chemically based, and that's why we use these products.